Hi, Dr. Peterson here with a bonus edition of Regions EMS Update. Two important topics have come up that our medical direction team would like you to be aware of. These are very important for patient care, so thanks for watching. And here are the two things you need to know. I touched on this in the regular March video update, but we're currently facing a serious medication crisis. For various reasons, pharmaceutical companies have had a hard time matching production with demand. This has created intermittent shortages of a variety of medications, and there seems to be no rhyme or reason to the problem. I'd like to emphasize that this is not a local or a regional issue. This is a shortage at a national level which is affecting hospitals, clinics, and EMS agencies all across the country. So here's the current situation. D10 is currently out. Whatever's in your truck is all you're going to get for now. Fortunately, the D50 shortage is over, so for the near future, you might be receiving D50 instead of D10, for those of you who have made the permanent switch to D10. Just remember that with D50, you don't have to give the whole dose at once, and you must dilute it for the little kids. Check out the Regions EMS Pediatric Diabetic Guideline for specifics. Moving on, the 1 to 10,000 cardiac epinephrine preload syringes are still nowhere in sight. You have most likely been stocking the small brown plastic bag with a vial of 1 to 1,000 epi, a syringe, and a vial of normal saline for dilution. As fate would have it, those 10 milliliter saline vials are running very short right now. The next epi kit you get may not have this vial. Please remember that you can never give 1 to 1,000 epi through an IV or an IO. It can only be given intramuscular unless you dilute it at least tenfold. In place of the 10 ml saline vials, our recommendation is that you carry 10 milliliter saline flush syringes and use one of those to draw up the 1 to 1,000 epi for dilution. Unfortunately, our pharmacy will not be able to supply these syringes in the bag with the epi, as they can't condone drawing up epinephrine into a syringe that is marked as containing only normal saline. So you'll be on your own to make sure you have everything stocked. Also remember that if you need to give push dose epi for hypotension, this should be diluted to a 1 to 100,000 concentration. This means that you will need to take your 10 ml saline flush syringe with the epi in it, waste another 9 mLs, and then redilute it with more saline to make a 1 to 100,000 concentration. This is very important to keep in mind, as epinephrine is one of the most risky medications to give via an IV or an IO if it's not diluted correctly. Okay, up next is ketamine. Never thought we'd see this day, but you need to be very careful with your ketamine right now. We are not able to get any ketamine from our supplier, and you all know how important this medication is. Please, please, please only use ketamine for true excited delirium when there is an imminent safety threat to the emergency responders, the patient, or other bystanders. Until further notice, do not use ketamine for pain control or for RSI induction. Stick with opioids or ice packs for pain, and this would be an excellent time to review the dosing for etomidate if you carry RSI medications. We think this shortage will last for the next 2 months, but who knows, so hunker down. The final medication shortage is fentanyl. Yes, you heard me, fentanyl. I really don't know what else to say about it. Between this and the ketamine, we have some serious concerns about patient care related to these medication shortages. We have looked into other options such as morphine and Dilaudid, but both of those are iffy, and our pharmacy cannot guarantee from day to day that they can supply our requests. We've considered bringing back Toradol, but there are too many side effects and interactions to be aware of. In addition to renal failure and GI bleeding, our surgeons have concerns about using this in any adult patient who might have a surgical problem or an orthopedic injury. This leaves us in a position where you may not always be able to treat your patient's pain. We understand this can be very frustrating, and I assure you that we are doing everything within our power to advocate at the state and national levels to support the production of these critical medications. For now, thanks for being flexible, and we will keep you updated as the medication situation evolves from week to week. Speaking of keeping you updated, with all of these dynamic changes in medication availability, We really need to be able to push out guideline updates quickly and efficiently. To help with that, we have transitioned our guidelines to an all-digital format. Some of you may have previously purchased the Paramedic Protocol Provider smartphone app, which allows you to download our guidelines, but we have now created our own custom mobile guideline app for both Apple and Android devices. I would highly encourage you to download this app, as we will be pushing out updates periodically to account for medication shortages and new evidence-based treatment options. The app is completely free to download, but you can't find it on the Apple Store or the Google Play Store. From your smartphone, go to www.regionzms.com, click on the Resources menu item, and scroll down to find the download links. For iPhone and iPad users, if the installer asks you for a redemption code, just click Redeem, and I promise you the code is pre-filled. Like I said before, the app is free. You will not be charged for anything. Anytime we push out an update, the app will prompt you to download the update, and of course, we will always send out an old-fashioned memo to make sure everyone is aware of the changes. We will continue to keep the guidelines PDF file up to date on the resources page of our website, and there is also a web-based version of the guidelines that will always be synced with the mobile app. All of these links are on the regionzms.com website, so check it out. Well, that's all I've got for this special edition of Regions EMS Update. If you haven't seen our monthly video updates, make sure you check out our YouTube channel, Facebook page, or Twitter account to stay up to date and hopefully entertained on the latest and greatest in EMS science. For everyone at Regions EMS, I'm Dr. Peterson. Stay safe out there, and thanks for watching.